Welcome to the all-new Kingdom Mandate Podcast. We address biblical principles that promote the kingdom of God and how they apply to our everyday lives at home, at work, and in the community. You're about to join our hosts, Pastor Reggie Davis and Derrick Turner, for an uplifting time of teaching, conversation, and empowerment. Thank you for tuning in. Join us weekly and invite a friend. Be blessed and welcome.
Welcome to the Kingdom Mandate Podcast. We're your host pastors. I'm Derrick Turner.
And I'm Reggie Davis.
And we have another episode, Reggie, where we get a chance to do kingdom and not just talk it. And today's special guest, we are going to talk medical issues in our community and among the community of believers.
Right.
And so let's get into who our special guest is here.
Yeah, absolutely. Today we're going to be speaking with, he's my brother, but he's also a doctor. His name is Dr. Eric Davis. He's a gastroenterologist. And so we're going to be talking with him to get some insight from him as far as what we as a people, need to be doing and being aware of, because our health, I think, is so important now, especially with COVID and everything that's going on. The scarcity that's prevalent now. So I think it's good for us to bring in a professional and to talk about some things, raise awareness in our community.
Absolutely. And that's the thing that we want you all, our listeners, to get out of this is a raised awareness. We know people who have had health issues. Probably the most famous in recent days has been the Black Panther, Chadwick Boseman. Yeah, the tragedy that was his young life, and such a influential figure to pass so young because of internal issues. And so we want to really raise awareness here in our community, and like I said, among the community of believers. We had this conversation with Dr. Davis, and we're going to take you to that conversation right now.
If you're promoting diet change, what are some of the things for sure that you definitely want to eliminate from your diet?
I wouldn't say you have to eliminate anything from your diet. I would say you should limit red meat. You should limit processed foods like sandwich meat and hot dogs and things that are processed. And just make sure you have more fruit, more vegetables in the diet, high fiber diet. Smoked foods, these are foods that contain a lot of carcinogens that probably are not the best for your colon, right? And so, and maintain a healthy lifestyle. Obesity can also predispose you to colon cancer. And I would just limit those. The other thing is, if you have a high fat diet with cakes, cookies, pies, those things itself also could lend itself to having, not the best colon.
Gotcha. Okay. So that grilling out, you kind of want to limit the grill out time.
Do it good, right? If you're gonna do it good, right?
And that's amazing because I guess for years, I think I'm probably not the only one who's thought this, that grilled food was actually probably better for you than fried food or.
Well, you make a good point. Grilled food is better, but smoked on the grill is different. That's different.
Okay.
Yeah, so you throw the wheels on the grill, bro, you got a lot of the charcoal smoke into the meat. If you put it in the oven and grill them, that's different.
It's a little different. Yeah.
Gotcha. Okay.
Yeah, that's a good distinction, though. Good distinction. Okay. All right, let's go. You got to go for my son.
Good is better. Okay.
Tell Uncle Reggie hi.
Hi, Uncle Reggie.
What's up, man? I see the tooth came out. Maybe one or two of them already came out. That's all right there. Looking like Leon Spinks. All right, man.
Good night.
Good night, man. Good night, man.
It's interesting because I think a lot of people are more inclined to take their health more seriously now. And I think we're seeing a surge of people who are, frankly, scared and afraid. As they get older, they want to make sure that they get the prostates checked, or they want to make sure their heart is fine, and so it is driving a lot more people, especially Black people to doctors. Again, there's a stigma and a fear of doctors, which is, rightfully so in a lot of families, and through our generations, there has been some bias towards us. But I think, you see a lot more Black physicians out here now that people are comfortable seeing. Yeah. And we're getting more people in to be screened and to be taken care of.
Okay, that's good. That's really good. I think with COVID, I think a lot of people have had a lot of time to kind of not only eat a lot and whatever, but they've had a lot of time to reflect and think. Oh, yeah. And I think you can, look at yourself, kind of evaluate where you are and what you're doing. I've noticed an increase in a lot of young people and older people working out more. Like they're really trying to get more active. So I know you would recommend a healthy lifestyle as far as exercise is concerned. But are there limits to some of that? Because I know our bodies change as we get older, and you can't, go lifting all this heavy weight, but you can stay active to keep yourself, I guess, in better shape.
Yes and no, right? So cardio is probably one of the better things for the heart, right? And keeping a nice healthy heart rate, high heart rate with exercising is actually better for you than just low impact things. Now people will say, well, yoga is beneficial, fine. Swimming is beneficial, fine. But cardiovascular training is good. The flip side of that is you have to be cleared by a physician before doing those things if you have some underlying health conditions, because you may not want to be out on a track or a treadmill when you have, heart disease or kidney disease. And so, yes, a healthy lifestyle, yes, exercise is great. But to your point, I think you have to make sure you're doing the right ones and not overdoing it. A lot of people out here, they are aggressively trying to lose weight. And so they get out there, they do all this, they're trying to bench press 300 pounds and they injure a shoulder, or they, injure themselves trying to do when they were, college age, weights. Right. So, they have to be careful doing that. But yeah, I do encourage exercise and weight loss. Oh, and about weight loss, that's a good point. Central obesity or waistline obesity, meaning beer bellies or, big guts, also is a high risk factor for developing bad disease, meaning cardiovascular disease, GI related diseases, diabetes. So, if you have the fat sitting right here, you're really putting yourself in a precarious position as far as developing these metabolic syndromes or diseases.
Wow. Okay. So we definitely, I think it's really an overhaul, a mental overhaul that has to take place. And I know financially, some are able to, maintain that diet, and because diets or just eating healthier can be expensive at times, because you don't have access to certain foods, right? Quality of foods, but to the best of, I guess, our abilities, we have to take into consideration what we're eating, limit the things that we know aren't good for us, but definitely make it.
But think about it though. I mean, a lot of poor people live in food deserts, right?
Yeah,
I mean, the access to these grocery stores, they're limited, and then even the products that these grocery stores may sell in the hood, they don't have high quality foods.
Yeah,
right.
And if you think about it, why do they sell you super fries, a super sized drink, all for under $5, right? Yeah. It's cheap stuff, but you can afford more. So they go to Wendy's or McDonald's and things like that. And they eat all these bad things, and they give you more servings than you actually need.
Yeah.
It gets worse. You know what I mean?
Yeah.
Yeah. That's what's I think in the Black community, certain parts of the Black community, it's more of that fast food mentality, more, especially now with things like Grubhub and things like that, so you're not even, you're sitting at home now, you can call and order your food, they bring it to your door.
Yeah.
So you're it's kind of a double whammy, COVID,
especially
go ahead.
I'm saying, especially when long gone are the days where pizza and Chinese were the only options for delivery.
Yeah.
I've spent the last, quite a few years, supplementing my income by rideshare driving, Uber and Lyft. And, one of the things that I do a lot of was Uber Eats. But I wasn't getting Uber Eats for pizza and Chinese. I was delivering Happy Meals to people. And I said we have become sad as a society because now we are sending out for McDonald's.
Right.
And it's just made the fast food more available to even people who might not have cars. But so now I'm delivering cold fries to you. It's bad though.
Very
bad. It is.
So one thing I know for sure here, man, we're trying to raise the awareness not only of how we interact with veterans, but how we interact with our own people, raising the awareness of making better choices. Period. Just making better choices. So one thing that we're striving to do is to bring professionals on, such as yourself, to raise awareness of the importance of our health, because I know that everyone's created differently. Body chemistry, body makeup is totally different. So I don't think there's one formula that just fits everybody. And I say that especially for Black people, I think that we have to be mindful of that and kind of we have to raise the awareness. We're working to raise the awareness of that importance, that we can't just do and eat everything. You can't just settle for everything. We can't just just because we want to be lazy at times, or just don't even want to try to do something. But there's always something we can do, and so here we want to try to raise that awareness, bring the awareness out, and highlight some of the positives that's coming out of our community as well. Everything's not always bad, but we want to keep things good, and that by keeping things good, we have to talk about taking care of our health. So
sure,
we're definitely working together, man, to bring this out.
Yes, that's I love it. I love the concept, and I think it's important. But the problem is, we can offer these type of suggestions, but really, it's so much deeper than that. Because what are some of these individuals who can't afford healthy diets? Because healthy eating, like you said, is expensive, right? So what are they supposed to do? The mother with 3 kids, working 2 jobs, and she has to come home. What is she going to do? Is she going to cook a healthy meal, or is she going to get the hamburger helper, right?
Right.
Or is she going to bring home McDonald's for $10, or some KFC for a bucket, a chicken? So it's. I think we definitely want to do that, but we don't want to, throw in their face all of these things that may be unrealistic for them, but yet still bring awareness to what they're doing, how hazardous it could be, right? So, for instance, if we say, yes, you understand that fruit, vegetables, fiber, salad, they're all more healthy for you, but most people say, well, I don't have access to that kind of stuff. Whole Foods is 20 miles down the road, and those foods are expensive. I'm going to stay right here at A&P, right? I'm going to stay here and get what I got. And so you got to say, okay, well, while you're there, look on the side of the box and see how many calories, how much fat is there, and try to pick things that are lower in fat. Look at the side. Those are things that may be more realistic for them, that they can actually implement.
Okay.
Drink more water. Don't get that high C fruit punch, and stuff like that.
I think we could. I definitely think we could put something together, because I don't, growing up, right? How many times, young people, even in your 20s, how many times are you're looking at the labels on the boxes, right? You're not even doing it. Even I think even in your 30s at times, people, you're not. But because of how things have changed as far as how foods are grown and processed, things like that, I agree with that. I think we should figure out a way, realistically, just to raise that awareness. Just pay attention to what you're doing.
Yeah, just raise awareness.
Just raise awareness.
Because man, you'll lose a lot of people if you start telling them, they need to not throw that bird on the grill.
Right. You had one of my feet out the door. I'm gonna tell you. You had one of my feet.
I can't grill.
I can't grill.
Right.
Cut this off.
We done this. Man, talking about lemons.
But you're right though. Yeah. And that's it, man. Finding out a better way to present it without condemning.
And we're gonna have to maybe go on a mission to find some sources, some realistic sources of healthier eating choices that might be affordable.
Yeah, that's a good idea.
Too. Absolutely.
Yeah.
So we have to do some research.
Yeah. So yeah, man. We want to keep this going, keep the conversation going. Bring other doctors in on the conversation. And, just put it out there. I like that approach. So I think it's more palatable.
Yeah.
And we just breaking it down on in layman's terms. Because people
exactly.
You can lose them. You can lose them quick.
And the other thing, my niece is. She talk a lot. She can talk a lot about oral health.
Mm-hmm.
And the importance of flossing.
Yeah.
And people take that kind of stuff for granted. And it's simple to do. And they say an ounce of prevention is worth a pound of cure. So some of these people would just brush their teeth twice a day for 2 minutes.
Yeah.
And floss.
Yeah.
That would save them thousands of dollars.
Wow.
In a dentist chair. Simple stuff like that. But people don't really take it seriously or know the importance of it. Because you say, hey man, you need to brush your teeth for 2 minutes twice a day. They'd be like, oh, I do that already. Really? You know what I mean? You floss, and you'd be surprised if you kind of just give them simple stuff that they're doing, but put it in practical terms. That can save a lot of lives too.
Yeah, see, man, this is why KMM is important, bro. Because we have torn away from church and just that, because what we've learned is that, man, so many people going to church, they're not doing anything, right? We talk about and we tearing people down, and we're going at people in a whole different way, man, and it's not necessary. So our angle here, man, is really, you can love God, but you still can help people. Like, let me tell you something. If your pipes in your basement are leaking, right? They're leaking water. And that man come up at midnight. You ain't asking him if he's saved. You ain't asking him what he believe in. You ain't I need you to fix my pipe.
Can you shut this water off?
Can you shut this water off, right? That's what
right.
it is.
Yeah.
So we got to get away from that nonsense, man. We got to talk what's real, put these issues out there, man, and let's make a difference. That's what it is. We're really
totally
serious about making a difference and getting away from all that wild stuff. Yep.
Yeah. Want to get to the. We want to answer the question. Now what?
Yeah.
We've gone to church.
Yeah.
We had a service. We played some music. We clapped our hands. We ran around the sanctuary. We hooped. We hollered. We bit the pews. We swung from the chandeliers. We did all that. Now I'm getting in the car. Now what? I still have high blood pressure.
Right.
Yeah. Right. Exactly right.
And while we do leave room to activate our faith, and we do believe that God can heal, there are some steps that we can do in the meantime. There's some things that we can proactively do.
Yeah.
For sure.
To help facilitate our own healing.
There you go.
Right.
Yeah. So yeah, man, that's where we are with this, bro. That's how we're doing it, and we're gonna move forward with it, man. We got a lot of support behind us, and
and speaking of how y'all doing it, I'm loving the background and the mic and the headphones. Y'all look like Steve Harvey over there.
If you're gonna do a thing, you got to do it well.
You gotta do it well. You gotta do it well, bro. You gotta do it well, bro.
Y'all boys looking right over there. I love it.
Yeah, man.
Ain't no playing around right now.
No.
Hey, you ain't got the little shower curtain or the sheet in the background.
No.
Hey, y'all ain't holding the mic like Mark Lawrence, y'all.
Watch me.
No. We got the real deal, bro.
Yeah.
Watch me, Doc. Watch me, Doc. Look at me. Look at me.
Got the green.
It's there.
We just
yeah.
Green room.
Got the green room, bro. Yeah. Got to do it right, man.
This ain't word on the street. This ain't
word on.
Right.
Thank you for tuning in to the Kingdom Mandate Podcast. Join us again next week as we continue to seek his kingdom. To support Kingdom Mandate Ministries, visit our website at kingdommandateministries.com and click donate. Your generosity is greatly appreciated. Until next week, we pray that you prosper and be in good health, even as your soul prospers. God bless.